Hi, I'm Bibiana. I am a busy working mum. I have 4-year-old twins and a 2-year-old toddler. I'm a dentist. I'm also part of the Channel Mum Expert team. You can find me there dishing out tips and advice on all things to do with teeth. It is the place to be to get all your questions answered from trained parent helpers, other mums and experts. And so I am excited today because I am bringing you to work with me, and I'll be answering some of the top questions I get asked from other mums and dads and sharing some of my top tips too. So let's go. At the moment, the surgery is quite busy, so I'm just going to film some of the answers inside this room and some of the answers in the surgery. Start brushing your baby's teeth as soon as the first milk teeth come through. This is usually around 6 months, but it can be earlier or later. I would definitely recommend using fluoride toothpaste because this can help prevent and control tooth decay. I would advise supervised brushing until your child is around 7 or 8 years old. And after the age of 7 or 8, assuming your child has enough dexterity to brush by themselves, then you should let them brush their own teeth. But I would pop in every now and then just to make sure they're doing it properly and brushing for at least 2 minutes. Guide your child's hands so they can feel the correct movement. It's a good idea to do this in front of a mirror so your child can see exactly where they're brushing. But personally, I do not use Flavoured toothpaste with my children just because of the risk that when they're older, they will not want to switch back to like a regular toothpaste, and also I find there's a higher risk of them eating the toothpaste. Now, if you have children who struggle brushing their teeth, then one could maybe consider using a mild flavoured toothpaste. So below 3, stick with the manual normal toothbrush, but above 3 you can consider transitioning to a child-friendly electric or battery-powered toothbrush. Electric toothbrushes, some have been proven to remove plaque more effectively, but at the end of the day it's all about the technique, and electric toothbrushes technically just do most of the work for you. Now, between the age of 6 to 12, you could use one as long as it's supervised by an adult and to make sure the child is using it in the correct way. And really just assess for yourself your child's ability to swish and spit out the mouthwash, because it's important they do not swallow it. I usually encourage them to stop the habit or at least reduce the frequency by the time the child's around 12 months old, only because this is a habit that's fairly difficult to break. And if it persists when the child now has permanent teeth, then you start having potential problems which can need dental intervention or end up being long-term. So this can include a persistent open bite, the speech being affected, and just a risk of really forcing teeth out of alignment or the jaw out of alignment, and hence needing a dental intervention. I would recommend taking a child to the dentist before their first birthday or when you see their first milk teeth or baby teeth start to erupt, whichever is sooner. Have a positive attitude. Really try and build excitement and joy about going to the dentist, because let's face it, it's definitely one of those experiences that children are naturally very nervous about. But at the same time, I would say do not build any false hope or give any presumptions about what is going to happen that day. The dentist is really there to take away all the bad guys, all the baddies in their teeth. You can have a mirror and the toothbrush and just kind of role play what's going to happen where the child sits on the chair and all the dentist does is count some of the teeth. Okay, so most of us know that sugar is harmful for our teeth, but it's actually thinking about the frequency rather than the amount, which is more important when thinking about the effect it can have on teeth. So I would recommend having sugary snacks with mealtimes as opposed to snacking regularly on sugary things throughout the day, and having safer snacks like fresh fruit and vegetable as opposed to dried fruits, which can be more sticky, and also having snacks like water and milk and cheese and crackers in between meals are better than snacking regularly throughout the day on sweet things. Thank you for having me. I've loved sharing my answers and tips and being part of the Channel Mum Meet the Expert series. And you can watch more videos in this series on channelmum.com, and do pop over to the Channel Mum support group where you can talk to me about anything about oral health, and I'll see you there. Bye!